WSNR, Jersey City.
Welcome to the Revival Healthcare Hour, brought to you as a public service by Revival Home Healthcare every Monday night from 8 to 9 p.m. right here at 620 a.m. on your radio dial. My name is Alan Mandel, and I will be your host this evening. This is the show that gives you the opportunity to speak to the finest medical professionals in the city without an appointment and ask the questions that are important to you. This is the show where our listening audience can call in and speak directly to our distinguished guests. We welcome your calls at 212-529-4620. Again, our number here, 212-529-4620. Tonight, we have as our distinguished guest in our studio, Dr. Gary Gettenberg. Dr. Gettenberg is a gastroenterologist of renown in the Brooklyn community with more than 20 years' experience in outpatient as well as hospital practice. Dr. Gettenberg received his medical degree at the New York Medical College in Valhalla. He subsequently did his residency and fellowship at Maimonides Hospital in Brooklyn, where he is currently an attending physician and has also served as Associate Director of the Department of Gastroenterology. Dr. Gettenberg is the founder and medical director of the Brooklyn Endoscopy and Ambulatory Surgery Center, a large gastroenterology practice with 5 board-certified gastroenterologists. Dr. Gettenberg has also been listed in the Castle Connolly Guide as one of the top doctors in New York for the past 8 years. Of note is that aside from his professional activities, the doctor has somehow found the time to personally initiate therapeutic programs in various hospitals in Eretz Yisrael for children with cancer, in addition to building a guest room facility at Rambam Hospital for families of cancer patients. Dr. Gettenberg, it is a cover to have you here with us tonight.
Thank you, Alan.
Also back here with us tonight is our multi-talented producer, who I may add is 40 years old this evening, Mazel Tov, Elchanan Hamada. Rabbi Elchanan.
Thank you for letting that secret out. Before we begin, I would like to tell everybody a little bit about our sponsor, Revival Home Healthcare. Revival was founded to provide skilled home health care to the Jewish community. When you or a loved one needs a visiting nurse, physical, occupational, speech therapist, or any type of home health aid to provide care at home after a hospital stay, an accident, or an illness, make sure that you specify to your doctor or social worker that you want Revival. Revival is a New York State certified agency and can provide highly skilled nurses, therapists, home health aides, and social workers trained to serve the Jewish community. The laws of Shabbos, Kashrus, and Tznius are all part of the training given to all of Revival staff. That is why Revival has long been the home care agency of choice for Jewish patients and their families. Contrary to what many people believe, a hospital stay is not mandatory in order to qualify for home care services. Revival, in conjunction with your doctor, can tailor a plan of care for any homebound patient. Revival accepts Medicare, Medicaid, as well as most insurance plans. Give us a call, 718-629-1000. That number again. Have a paper? 718-629-1000. And a qualified home care specialist will be happy to help you. Remember, it's your health, your home, your choice. Revival, the right choice. Alan?
Thank you, Rabbi Hanan. Dr. Gettenberg, I know that you have a busy schedule and that you just flew in from out of town earlier. So I want to thank you for coming over after a long, hard day. If not going back to sleep, welcome back.
Thank you.
I see that you are doubly boarded in both internal medicine and gastroenterology. I've been practicing on how to pronounce that word so I get it right.
Did it well.
Okay. I know that the second word there, gastroenterology, is the study of the digestive system. I messed up on another one. Okay. Let me ask you, how and why might a patient come to you? Do you see your patients as referrals from other physicians, from other primary doctors, or do patients come to you directly?
Alan, that's a great question and a good point to start off. First of all, we're happy to see patients who understand that they need to see somebody who specializes in nutrition and digestive diseases. But we do a lot of work based on referrals, and we are specialists that add our expertise to the management of a lot of patients with these issues.
Well, okay. So you see patients from basically, I don't want to say from the street, but you see patients who are not referred, and you see patients who other physicians, other professionals would refer to you. Do you receive more referrals at this time of the year after a 8-day yontiv of what I would call constantly eating? Was it just me?
No, that's a very common thing that we see patients who've really enjoyed themselves during the yontif and maybe had a little bit too much to eat and are kind of suffering right now. But really we also do a lot of work that's preventative, not just people who have complaints. And that's one of the areas of our specialty and our expertise, especially in my group, is the prevention of serious illnesses and to do things that can be done easily before you have to do more serious interventions.
Well, as the saying goes, you always feel better when you get to the doctor. Okay. I wasn't feeling that good. I feel a lot safer, though, around you, in spite of what I did over the last 8 days. Now, most of us are aware, in simplistic terms, that the digestive system refers to the series of specific organs in the body that enable us to eat and use the food that we consume into the type and form of nutrients that the body needs in order to continue functioning successfully. At the same time, this particular system also serves to eliminate what is not necessary and what might in fact be harmful. In order to get this all to work properly, HaKadosh Baruch Hu has created in each of us an intricate system of organs that work together in what seems to be perfect harmony, each organ contributing respectively to either absorbing or eliminating what goes into our mouth, very often without the person's own regard for his safety, and yet selecting the types and amounts of food that we consume and using them wisely. It's small wonder that Chazal saw it fit to establish the bracha of Asher Yotzer for every time we witness the miracle of the workings of this particular system and its components. Having said that, let's look to the goal tonight and to educate us a little bit about this miraculous system, guide us into what to look for, when to do so, how to do so, in order to, as you said, avoid illnesses that sometimes might occur without telltale symptoms to alert the person. What happens, Dr. Gettenberg, when a typical American male bites into, say, a hamburger? What is set into motion in order to process this food?
You know, it's very interesting that a lot of things that we take for granted are really very complicated. And the first question is, should be biting the hamburger or should be having a salad? But let's say he does eat the hamburger.
Who does that hurt? Okay.
Let's say he does have the hamburger, and it's once a week, and he's going to have some red meat, and he enjoys that hamburger. Let's say he does have a hamburger. So, as you said, God in His infinite wisdom has created a system where that food is taken off the plate into one's hands, and then he bites it. And once that starts, that begins a cascade of very complicated and coordinated events that ultimately leads to us taking the energy from that food and using it as a source of energy.